Now let's look at the case of perpendicular L alignment. In assist-free dentistry for visibility attainment, whether you are working on the 20 series or the 40 series, it is always sufficient to have the light shining vertically downwards, as demonstrated here. During incisal preparation, the patient's head is rotated to the right, and the doctor is positioned at 3 o'clock, aligning perpendicularly with the axis of tooth 42. The doctor's neck is slightly flexed to the right. The suction tube is grasped in the left hand. This is done to protect the tongue by interposing the bulk of the suction tip between the burr and the tongue during incisal preparation, preventing them from making contact. Left third finger. There's a specific maneuver where you slightly elevate the obtrugate wing. This is specifically to prevent any sprayed water from accumulating on the wing's surface and subsequently flowing onto the patient. As you can see here, it would be ideal if the lower anterior tooth axis and the doctor's line of sight are parallel and aligned. For this, the doctor's neck will undergo a slight lateral flexion to the right. This is because we wish to align this line of sight as closely parallel as possible with the axis of the lower anterior teeth. Therefore, for the doctor's neck health, it is ideal to set the maximal vertical setting of lower anterior tooth axis as close to vertical as possible. This is achieved by first giving an inclination to the chair upper part, then a secondary inclination by raising the headrest, and finally a tertiary inclination by having the patient perform forward flexion. This incisal preparation of tooth number 42 is particularly interesting as it showcases the versatile usage of both the doctor's left and right hand fingers. When observing notable details in this photograph, one can first see the third finger of the left hand gently raising the lower wing of the obtrugate into a vertical position. Additionally, the fourth and fifth fingers of the left hand are resting on the right masseter muscle. The first and second fingers of the left hand are grasping the suction, and particularly, the left hand's second finger is obtaining an auxiliary rest on the 30's anterior region. It's also noteworthy that the left hand grasped suction tip protects the tongue's soft tissue by positioning between the burr and the tongue, and the right hand's fourth finger. Even though it's obscured from view here, the fourth finger of the right hand is obtaining a hard tissue rest in the premolar region of the 40's. Therefore, in two-handed dentistry, it can be said that all fingers are utilized in a comprehensive and creative manner. Alright, next, we'll examine the mesial and distal preparations from the buccal aspect. If you imagine it, this perpendicular L alignment is not suitable for the bucco-distal triangle and the distal surface because it's hard to get good visibility. Conversely, you can visualize that for bucco-mesial preparation, the perpendicular L alignment offers greater advantages compared to perpendicular R. In this alignment, the patient's head is turned slightly to the left to help with visibility, and the doctor's position is at 4 o'clock, a bit more clockwise than 3 o'clock. The fourth and fifth fingers of my left hand find a soft tissue rest on the masseter muscle, and the fourth finger of my right hand gains a hard tissue rest on the left premolar. You have no choice but to approach with the handpiece axis parallel to the plane of the oral orifice, and that's why. Unlike before, the handpiece's line is now set by allowing it to extend downwards, beneath the headrest. It is important to note that the lower wing of the obtrugate has been propped up with these second and third fingers, specifically to prevent water spray from the handpiece from splashing downwards. Next, let's examine the lingual preparation of tooth number 42. The perpendicular L alignment is more advantageous for the lingual preparation of the 40 series anterior teeth. This is because the 40 series is on the right. For the 30 series anterior lingual preparation, perpendicular R alignment offers better visibility. To achieve better visibility of the lingual surface, the patient's head is rotated toward the right side. The right handpiece should be grasped with a long grip, not a short one like this, and the fourth finger finds its rest on the zygoma. To mitigate any instability in the handpiece head, often caused by using a long grip and relying on soft tissue for support, the third finger of the left hand is used to provide additional stabilization to the handpiece head. Now, This slide illustrates a setup where the perpendicular L alignment is used to target the number 42 incisor with the suction tube hooked. However, this particular approach is not very advisable. This is because, as you can see here, the tongue protection is unstable during the incisor preparation. Therefore, rather than employing a hooking method, grasping the suction tube is preferable. If that is not feasible, it is advisable to use the mirror head you hold in your left hand, placing it between the burr and the tongue to provide adequate tongue protection. Additionally, from this particular doctor's position, the practitioner's, you can observe that my left arm is significantly extended outwards, and my left shoulder is also raised. This posture is adopted to avoid contact between my left arm and the patient's body, or their left arm. However, this positioning is not entirely ideal either. How should we correct this? If you've been diligently following the lecture, the answer should be clear by now. That's right, you need to try and find a better posture by changing the higher level, more fundamental posture elements. In this specific situation, if the doctor adjusts their position, moving counterclockwise from the current spot and orienting themselves midway between the perpendicular L alignment and a parallel alignment, it's possible to secure ample room. This space effectively prevents the doctor's arm from making contact with the patient's body. Let's examine the mesial and distal preparation of tooth number 42's buccal aspect. This is the hooking mode in the perpendicular L alignment. In this specific situation, since the tooth mass effectively provides protection for the tongue, it allows for greater freedom of movement for the left hand, making this particular mode more advantageous. There are no other special posture elements to note. I'll just mention that with my now freer left hand, I'm using my first and second fingers to hold the obtrugate wing vertically to prevent water from spilling out of the mouth, and then we'll move on. Alright, in the perpendicular L alignment, let's look at the mesial and distal preparation of the lingual side of tooth number 42 in hooking mode. For the exact same reasons explained in the previous slide, I don't really recommend this either. It is preferable to use the grasping mode over the hooking mode, utilizing the suction tip to protect the tongue from the burr during preparation. I will just briefly touch upon this slide and then we will proceed. I want to emphasize again that through the primary, secondary, and tertiary inclinations in this semi-supine mode, the axis of the lower anterior teeth should be positioned nearly vertical, closer to the ceiling. The more vertically the tooth axis is aligned, the more effectively you can prevent excessive lateral flexion of the doctor's neck, which would otherwise be required to align the line of sight with the tooth's axis. This also showed a similar correlation in the chapter on the 20s series. I previously emphasized that the more the headrest's angle is reclined during treatment of anterior teeth in the 20s series, the less forward flexion strain the doctor's neck will experience. I want to highlight that, by comparing and contrasting the maxilla and mandible of the 20s and 40s series, you can gain meaningful insights related to posture. We have now concluded the overview of the various postural elements concerning the mandibular incisors in section 2-1. Thank you for your attention.